No, our panel is nonpartisan, but will share with us what they might suggest to the new chief executive in Congress about how we can help expand healthcare coverage and choice, as well as control cost versus the current status quo. So let us start off with Grace Marie Turner.
Thank you very much, Larry. It's a pleasure to be with you all this morning. And I think this is it's really an incredibly important topic to discuss. How do we revolutionize our healthcare system? For such a long time, we have been talking about the three pillars of reform: cost, quality, and access. And nobody disagrees with the goals. But there is major disagreement over how you achieve those goals and what are the implementation strategies, including this year with the very different public policy initiatives that both Senator McCain and Senator Obama are offering, built around the same goals but very different policy alternatives. When you think about the three of them, quality is really, there's just no debate. I mean, everybody knows we have got to not only keep the quality of our current healthcare system, but enhance it. That is crucial. But cost and access, when you begin to sort of talk about which direction shall we go, for the 85% of people who have health insurance, cost is the primary issue. For the 15% who are uninsured, access is the major issue. And the people who have coverage there's an altruism that yes, we want people to have access to coverage, but don't change what we've got. And the people who don't have access to coverage, for them, the major issue is also cost, but there are also a lot of other barriers to their access to care. So those are so entrenched that we've already seen it's very difficult to move the current debate when we focus on those three pillars, which is why I think that today's panel is particularly important in really helping us to think outside the box. What can we do to really move to new kinds of solutions and take advantage of some of the things that we already see happening and some of the pressures and the challenges to really begin to provide real solutions to people? People want choice and control. I do a lot of speaking internationally. I spoke at the Vatican last fall. I was in Milan this summer. And this movement toward consumerism is really a global phenomenon. And it is energized by the information age. People find out more about treatments that are available. They want to have more control over choices and decisions. That's a given. There are also other things in this presidential election campaign that there's general agreement about. Things like the importance of prevention, the importance of coordinated care, the importance of disease management, the need for medical homes, the incredibly important opportunities to use information technologies to give people better care more cost effectively and more efficiently. So you're going to be hearing today about some of the initiatives that can really help us to move into a new direction. Melinda is going to be talking about both the challenges and the opportunities to use some of these information technologies to really help us move into a 21st century healthcare system. Christine is going to be talking about both the challenges and the opportunities to address workforce issues. Workforce issues are hugely important, and they really are seldom on the radar screen of policymakers. But we've seen in states like Massachusetts, which has implemented a universal coverage system, that one of the first major challenges they're facing is the workforce, that 50% of internists and family medicine physicians have closed their practices to new patients. People have written to me and saying, before I didn't have access to the healthcare system because I wasn't insured. Now there's a mandate for insurance. I've bought insurance. I'm paying for it. And I still can't see a doctor. So if we don't address the workforce issues, then the promise of insurance is really meaningless. And there also are huge opportunities to look beyond traditional medicine to complementary and alternative medicines and different ways, including prayer-based and faith-based medicine, that really can help people integrate their care system and get back to this issue of choice. Let people have the kind of care and the kind of opportunities that help them be masters of their care. We have seen recent research from Health Affairs that when you look at the determinants of early death, 40% is behavior, 30% genetics, 15% environmental and social factors. Only 10% is access to the healthcare system and what healthcare can do as an intervention. So if we don't address the behavior issue and give people new incentives to be active partners in managing their care, we're never going to be able to solve these problems. And I think it's also important to look at some of the things that are happening in the marketplace to give people more options and more opportunities to have access more convenient, more affordable care. Things like Walmart deciding, what is it people want? They want less expensive drugs. We can do that. We'll give people a month's supply of generic drugs for $4, 3 months supply for $10. Other competitors then come in and say, well, we can do that too. We don't want to lose that business. So you begin to see a movement toward the economy responding to what people want. Med clinics, convenient care clinics, Reddit clinics. There's one down the road from my house in Alexandria where you can go without an appointment, in and out, 15 minutes. Prices are posted, a limited range of services, but they actually happen to be 70% of the things that people generally will go to a family practitioner for. Things like ear infections and poison ivy and flu shots and routine care, but something that people don't have to take a half day off work, get their child out of school in order to be able to go see a physician. And they actually are managed by nurse practitioners that are really using Mayo Clinic protocols, Cleveland Clinic protocols, in order to make decisions. It's very important. Patient-centered medicine, and including a lot of incentives for employers to give people new opportunities to be in control of their health care. Things like wellness programs and on-site clinics, smoking cessation programs, because they've seen they can provide people incentives to take advantage of some of the things they can do to help manage their own health, that they can save costs, they can save on healthcare expenditures in the long run. So there are a lot of opportunities out there for people to think outside this political box of cost, quality, access, determinants in Washington. We've got to engage consumers. We've got to engage the incentives and the innovation and the free market economy. Think outside the box. People ask me often, what's the right answer for our healthcare system? Which of the other countries should we emulate in reforming our healthcare system? None of them. We've got to come to a uniquely American solution to solving the problems in our health sector. And that means building on the strengths of our health sector, looking at the problems, figuring out what consumers and the marketplace can solve, getting policymakers on the page to try to change some of those incentives. And in fact, I've got a piece that I had in the Wall Street Journal last week as a handout outside if you didn't get it, talking about a simple thing that members of Congress could do, doesn't cost anything, that could increase access to health insurance for at least 12 million people. And that's simply allowing the barriers that states have created that force people to buy health insurance just in their states, often highly regulated, often overly expensive unnecessarily because legislators are deciding what kind of health insurance people have to have rather than people themselves. If people could buy across state lines in a national market, there would be huge new efficiencies. Economists from the University of Minnesota have said at least 12 million people. And you add on to that some new subsidies to help people at the lower end of the income scale get coverage, and you could dramatically solve the problem of the uninsured. Then we need to address these other issues: cost, quality, access, information technologies, better coordinated care, etc. So there are huge opportunities, and I encourage us all to really think outside the box of the current debate, which really is stalemate, to think about this uniquely American 21st century solution to the problems in our health sector. Thank you very much.
Steve,